Hello, my name is Michelle Wynn. Today I will be demonstrating the insertion of a Foley catheter on a female patient. I am in my appropriate school uniform. I have my badge on, no jewelry, no nails. For today's skill, I will be using a female patient, a trash bag, gloves, washcloths, and a Foley catheter kit. I will proceed by checking the doctor's order, ensuring that I have the correct size Foley. I will gather my supplies, proceed to my patient's room. I will knock before entering. I will close the door behind me. I will close the curtain for patient privacy. I will place my supplies down on a clean, dry, flat surface, and then I will perform hand hygiene and introduce myself to my patient. Hello, my name is Michelle. I will be your nurse today. Can you please tell me your name and your date of birth? Okay, I have visually confirmed what they told me with their wristband. Thank you, Ms. Jones, for verifying that information. Your doctor has ordered the placement of a Foley catheter. What that is a tube will be inserted into your bladder and it will continuously drain urine. Do you have any questions? And do I have your permission to proceed? Okay, thank you. So I am going to set up my supplies. Ms. Jones, I am going to need to lower your head so that you're laying flat. And then I'm going to raise the bed so that it's a good working height for me, okay? Okay, and in order to do this, I will need access to your perineal area. So what I need for you to do, if you could bend your knees and open them. Okay, and I'm going to pull the cover back, okay? Okay, so I know it may be a little cold, but let me know if you're uncomfortable or if you experience any pain, okay? Okay, so I am going to need to touch you to do this procedure. Is it okay to touch you? Okay, thank you. So I am going to use these washcloths. This washcloth has water and a non-rinse soap on it. So I will be touching you now, and I am going to clean from the farthest area from top to bottom. I will get a clean area on the rag and clean the nearest labia to me, top to bottom. And then I will clean down the center, top to bottom. Now I have my dry rag, and I will do the same motion in the same order. Okay, top to bottom. Okay, now Ms. Jones, I'm just going to be looking down here, okay? So when you're looking, you just want to check the anatomy. You want to make sure that you can see the urinary meatus. You want to make sure that there's no discoloration, no discharge, and no odor. Okay, everything looks good. Okay, I'm going to perform hand hygiene. Okay, Ms. Jones, this next part is going to require me to pull out my sterile supplies. I'm going to need for you to keep your legs open so that I can place my supplies in between your legs. It's important not to move and not to touch any of my supplies, okay? You have any questions? Okay. I'm going to dispose of this. Okay, I'm just going to turn this around a little. And again, I'm only touching the border area. Okay, I will grab my gloves. Okay, using 2 fingers, I will grab my gloves. Using these 4 fingers, I will pick up my second glove. Okay, I will pick this up in the middle and dispose of this. Okay, next I will be pulling out a drape, Miss Jones. I am going to place this drape under you, so I will need for you to raise your hips a little, okay? Okay. Now that I do have my sterile gloves on, I can move this. I can touch the middle and move it a little. Okay. Okay, now I will apply a drape over your perineal area. Okay, now I'm just going to reposition this a little. Get my supplies together. Get my alcohol swabs out. Put some lubricant in here. Next, I will get the catheter out. I will place this tube inside the lube. I will connect my syringe, removing the top and attaching it to the tubing. Okay, so Ms. Jones, I will begin cleaning. I'll have to clean you again. I have three alcohol swabs that I'll be using. It will be a little cold, okay? And I am gonna have to touch you again, okay? Okay. So you clean this in the same manner where you clean the nearest to the farthest to the nearest in a top down motion or anterior to posterior. And then you do the center. Okay. Okay, so next I am going to get the tip of my tubing, make sure that there's lubrication on here. Miss Jones, what I will be doing next is I will be inserting the catheter tube, okay? I have put lubrication on here, so it shouldn't be painful going in, but if you experience any discomfort, please let me know, okay? What I'm gonna need for you to do is if you can breathe in and breathe out, and when you exhale, I will insert it, okay? Okay, you insert it 2 to 3 inches until you visually see urine. Once you see the urine, you can insert it 2 more inches. Okay, now I am going to move my hand, my dominant hand, and replace it holding the tubing with my non-dominant hand to secure it in place. I will use my dominant hand to grab the syringe, which is already filled with 10 milliliters. When I insert this, this will inflate the balloon. And you just want to ensure that you put in the full 10 milliliters. Okay, and then you want to disconnect your tubing from the syringe and dispose of this. Okay, and now you just want to pull for resistance. Okay. Okay, next, want to provide perineal care. Okay, and Ms. Jones, I am going to attach this to your leg, okay? So you attach it to the leg, and then attach the bag to the bed. When attaching to the bed, you want to make sure that you do not put it on any moving parts, like the bed rails. You don't want to put it there. Okay, so now I'm just going to gather all of my supplies to get rid of them. Remove my gloves. Perform hand hygiene. Miss Jones, how are you feeling? Okay. So, just to reiterate, this tubing is connected to your leg. So, if you need to move around in your bed, just be careful so that there's no tension and so that it's not pulling. Also, if you need to get out of the bed, please use your call light so that we can help you because this bag and the tubing can become a safety hazard. And then also, if you're sitting in a chair or if you need to be transported in a wheelchair, make sure that the bag is hanging low beneath your bladder. Okay. Okay. So I have raised you up already. So are you comfortable or do you want to lay back down? Okay, so you're in a comfortable position. Here's your call light. If you need anything or if you have any concerns or questions, please give us a call. Okay? Okay, so I am going to go document.